Yes. Hello friends, good evening. Am I audible? Am I audible, guys? Yes, Rakesh, good evening. Am I audible and visible? So, welcome to most important questions, the predictor questions that can be asked in your upcoming FMGE exam. So, without wasting time, so let's start. Okay. Yes, Rakesh. How are you, Rakesh? How is your preparation going on? Mani, how is your preparation going on? Divya, how is your preparation? I hope you are doing well. Yes. So, as you know, forensic medicine, one of the very important scoring subject in your any exam, FMGE, NEET PG, INICET. At least there will be 10 to 12 questions. In last INICET exam, they asked around 12 questions from forensic medicine. Okay. So, let's discuss the first topic. The first question from asphyxial death, that is basically hanging. Let's make it interactive. Just go through the question and try to answer. And let's discuss few MCQ that can be framed from the same question in upcoming FMG exam. A case of hanging has come to forensic department. So, forensic medicine department basically for post-mortem. For autopsy, the autopsy surgeon notices ligature mark covering about 1/3 of neck, protruded tongue, salivary stain, open left eye, closed right eye, both the pupils dilated. What is the most probable reason for open right eye? So, what would be the best answer? Chalo. Can you answer? Can you answer, guys? Options are compression of intrajugular vein, compression of internal carotid artery, compression of cervical sympathetic chain, and vagus nerve. This classical finding, what you can see here, the one eye is open, other eye is closed on the same side of knot, is left face is sympathetic. Okay. So, what is the finding here? Left face is sympathetic. The question is, what is the mechanism behind this? Yes, very good, Rakesh, Riaz and Mani. As answer is compression of cervical sympathetic chain. And try to memorize, this is seen on the same side of knot. So, the answer is C is the correct answer. Try to memorize ligature mark. Ligature mark is very important finding in case of hanging. In hanging, it is transverse. Transverse? No, in hanging it is oblique. So, try to memorize, in hanging it is oblique. In case of strangulation, it is transverse. Strangulation, it is transverse. The transverse ligature mark can be seen in partial hanging, that is asked in one of the FMG exam. Transverse ligature mark classically seen in ligature strangulation, that can be seen in hanging, especially in case of partial hanging. Frequently asked question. The hanging, the cause of death is asphyxia. It can be venous congestion. The most common cause of death is asphyxia plus venous congestion. Frequently asked. And remember, hard bone fracture. The outward fracture is very common, especially junction of inner 2/3 and outer 1/3. So, that is known as outward fracture, outward compression fracture, that is classically seen in case of hanging. So, the answer is basically that is C. Now you can see here salivary stain. Salivary stain, one of the surest sign of ante-mortem hanging. If question asked in FMGE, surest sign of ante-mortem hanging, your answer must be dribbling of saliva. Okay, salivary sign is a surest sign. Surest sign of ante-mortem hanging. Try to memorize 3 important FMGE questions. Surest sign of antemortem burn injury, soot particle in the trachea and in the lungs. Surest sign of drowning, cadaveric spasm with aquatic matter. Surest sign of antemortem hanging, that is your salivary stain. The salivary stain normally present opposite to the side of knot. Okay. Yes, so this is frequently asked topic, commonly asked. Now once again, just go through this AI image. One eye is open, other eye is closed. The pupil on the same side of knot is more dilated. This is known as left facies sympathetic. It is because of compression of cervical sympathetic chain. It is commonly seen in antemortem hanging around 33% of the cases. Okay. So this is about the question number 1, topic number 1. The second question from mechanical injury, frequently asked in the exam. So what is this? A 50-year-old died due to road traffic accident as a result of shock and hemorrhage. Identify the autopsy finding, the type of abrasion given below. So the abrasion you can see here, parallel lines. The parallel lines are there. We can make out here. What is this abrasion? Options are graze abrasion, pressure abrasion, imprint abrasion, scratch abrasion. As you know, abrasion is the most common mechanical injury. It is of 4 types. What is this abrasion? Try. So the first to answer, that is by Raj, very good Raj. So the answer is graze abrasion. The graze abrasion is the most common abrasion characterized by the parallel lines. Most common. The pressure abrasion commonly seen in case of hanging and ligature strangulation. Hanging and ligature strangulation. Very, very important question. Imprint abrasion, example tire mark or radiator grill mark. By looking at the abrasion, you will come to know the type of weapon that is used in the crime. That is imprint abrasion. Scratch abrasion commonly seen in case of rape or in case of throttling. So very important question. Try to memorize. Most common abrasion, graze abrasion. Most common mechanical injury, abrasion. Abrasion is a superficial injury. It does not cause any scar formation. Most of the time, it is considered as simple hurt. Simple hurt. Okay. So this is very, very commonly asked. Now, okay. Next question from identification, especially the age estimation with the help of ossification centers. Now look at this question. Try to memorize. When a juvenile as you know, male or female less than 18 years, is a victim under the POCSO Act, the Department of Forensic Medicine is consulted to determine the child's age. What is the age? Less than 12 years, less than 16 years, less than 18 years, more than 18 years. The hand, that is X-ray that is given, wrist joint is given. What is the child likely age? Try now. Try. Yes, Divya, Tokir. Okay, so this is basically wrist joint. So what we can see here, this is the radius and this is ulna. So this is lower end of radius, this is the lower end of ulna, and there is no fusion here. You can see the clear gap there. You can make out here, clear gap. It is unfused. That means it must be less than 18. I am sure because the ulna and radius, it is not fused less than 18 here. Now, can anyone try? Look at this physiform. Physiform is there. Physiform is appeared. The physiform normally 9 to 11 year. So the options are 3 to 4 year, 5 to 6 year, 9 to 11 year, 18, 19. It is not 18, 19. because radius ulna fused. It is not 3 to 4 year. Why? Because physiform is appeared. That is more than 9 year. 5 to 6 year, that is usually trapezium and trapezoid that appears at the age of 5 to 6 year. So the better answer is 9 to 11 year. 9 to 11. This is frequently asked in the exam. And remember, POXO Act can be asked in your exam. It was passed in the year 2012. And you must know what are the offences under POXO Act. After the class, just go through this definition. PSA, penetrative sexual assault, asked once in the FMGE exam. APSA, sexual assault, aggravated sexual assault, and sexual harassment. So there are 5 offences. This PSA, penetrative sexual assault, asked once. So, okay. Once again, I'll repeat. This is basically scaphoid appeared. Scaphoid appears at 5 years. So next to that, we have hamate. The hamate usually 2 months. Hamate, then capitate 2 months. Trapezium, trapezoid 5 to 6 years. Physiform 9 to 11 years. Yes, fine. So this is about the identification. Next question. Next question from mechanical injury, laceration. Identify the lesion shown in the image. Options are avulse laceration, incised wound over the forehead, laceration looking incised wound, incised looking laceration. Look at this. This is the case of road traffic accident. So this is the injury over the bony prominence. It looks like an incised wound. The question is, identify this. So what is the best answer? Try. Bharat. Okay, Aish, fine. Okay. Aish, this is capitate. At the center is there, no? That is capitate. So next to that is the hamate. Okay. So this is scaphoid and lunate. Lunate, triquetral, physiform. So this is the proximal row. So distal row you can see here, trapezium, trapezoid, and we have hamate, and also we have look at this. This is the proximal and distal row. It's very easy only. Yes, Bharat, I am happy. I am very, very happy. Always happy. No problem in my life. Okay, chalo. Look at this now. Try to answer. What is this? So this is classical laceration. Laceration with irregular margin. So margins are irregular. Bony prominence. And one more very important very important finding here is bridging of tissues. Bridging tissue. Now can you answer? Bony prominence, bridging tissue, irregular margin. Your answer must be incised looking laceration. Frequently asked in FMGE. Avulse laceration, characterized by detachment, that is basically flaying. Again, FMGE question. Flaying is a feature of avulse laceration. Amputation, flaying, deglowing. Deglowing asked once. Incised wound over forehead. Incised wound has regular margin. Regular margins. MCQ. Laceration looking incised wound. Incised wound looks like a lacerated wound. Commonly over axilla and scrotum. So the answer is D is the correct answer. Incised looking laceration. The common sites are over the scalp, over the iliac crest, over the medial malleolus, tibia, fibula and all. Okay? So the answer is D. I think many Rakesh answered correctly. Ayush, okay, fine. Ibrahim, D, very good. Riyaj, very good. And Reddy, good answer. Great. Chalo. So the next question from blast injury. One more very important topic. It is asked in recent INA CET also. A male was brought dead in casualty with a lacerated wound. Laceration caused by blunt weapon over the anterior part of the chest. Multiple punctate abrasion, punctate lacerations over the lower limb. Which is true regarding mechanism of above injury? So try to concentrate. So a case of bomb blast injury with the punctate abrasion. Okay. Punctate abrasion. Point number 1. Point number 2. Punctate bruise. Punctate bruise and laceration. So this is classical of blast injury, Marshall's triad. So what is this? Marshall's triad. The question is, what is the mechanism of Marshall triad? So this is the question asked. So Rakesh is telling, sir, quaternary blast injury. No. Let's try all of you guys. Okay, Riyaj is telling A. Very good, Riyaj, and Divya, excellent answer. So, and also by Parth. So it is because of flying missiles or secondary blast injury. Secondary blast injury is because of flying missiles. Okay? And secondary blast injury is the most common blast injury. It is the most common cause for mortality and morbidity. So A is the correct answer. Try to memorize. Marshall triad is because of secondary blast injury. Then primary blast injury, again commonly asked. 3 organs commonly affected in primary blast injury. One is ear, lung and intestine. Most common organ affected in air blast. Your answer should be ear. Most common. Same question. Most common organ affected and which leads to mortality. Lung. Lung leads to mortality. So in lung, so there can be diffuse lung injury. Intestine, that is also commonly injured. Remember, the most common organ affected in underwater blast, that is intestine, frequently asked in the exam. Intestine, underwater blast. Solid blast, skeletal injuries. Okay, that is about the B, not the answer. Tertiary blast injury. Tertiary blast injury is because of victim displacement. There can be amputation, head injury and death. Quaternary is because of structural damage. Structural damage. There can be electrocution, bone injury. They are basically quaternary. Quinary blast injury, that is because of the radiation. So there are 5 types of blast injury: primary, secondary, tertiary, quaternary and quinary. Most common, secondary blast injury. Most common causing mortality, lung injury. Marshall triad, secondary blast injury. So this is how you can at least 5 questions for sure, Bharat. At least 5 questions. Okay. So this is okay, fine. Chalo. Next topic, very important topic, that is seminal stain and blood stain. Favorite of FMGE exam. Pakka question. Look at this. A suspected blood sample has been evaluated from a crime scene. Following observation is noted under microscope. Identify the test demonstrated. Now, go through this. This is a very beautiful image that is showing brown rhombic crystals. Okay, brown rhombic. Can anyone try? Brown rhombic crystal. ठीक है, चल चलो ठीक है भरत, बताओ जल्दी बताओ क्या आंसर है। जल्दी जल्दी बताओ क्या आंसर है। ब्राउन रोम्बिक, बार्बेरियो, टिकमन, टकायामा, बेंजिडिन. Benzidine, it is not hemine crystal test. It is a screening test. It gives rise to blue color. Rolled out. Takayama. Remember Takayama. I remember Takamama. Pink feathery crystals. Pink mama. Okay. Pink feathery crystals. Remember Yama, pink mama. Then Teekman. Teekman, remember brown man. So it's brown rhombic. Brown man. Barberio, yellow needle crystals. Yellow needle. Barberio test basically for seminal stain, not for the blood stain. Okay? Yes. Now, don't worry, Divya, I'll help you in that. Takayama and Teekman for the blood stain. Takayama, Yama, Mama, pink feathery crystal. That is Teekman, that is a brown man, brown rhombic crystal. Barberio, Barberio, yellow needle shaped crystals. And Benzidine, that is screening test for blood stain. Now, this is the image. Try to memorize this. This is a very, very important image. Many question asked. Many. Teekman, you can see here brown rhombic. Takayama. Takayama, remember hemochromogen crystals. Pink feathery. Yellow needle shaped crystals. Barberio test. Basically, spermine picrate crystals. That confirms the seminal fluid. Florence test. That is basically choline iodide. Again, they are dark brown rhombic. So, these two are basically for seminal stain. And these two for the blood stain. Try to memorize this. This is commonly asked. Divya, is it okay now? Ayush, Bharat, is it clear? Frequently asked. Pakka question, probably in upcoming NEET PG and FMGE. Seminal stain, blood stain. So, chalo. आगे देखते हैं. Now, this is one more easy question, especially head injury, road traffic accident. Patient came with a history of head injury due to road traffic accident. The CT scan is given below. Diagnosis is. So, what is the finding here? Look at this. This is the finding. That is concavo-convex appearance. Concavo-convex opacity. So, what is this? Options EDH, SAH, SDH, ICH. Good. चलो देखते हैं. हाँ, good. So, this is basically SDH. SDH commonly occurs because of the minor injuries or because of bleeding from the bridging veins. Remember SDH, bridging veins, BV. EDH, biconvex appearance, bleeding from middle meningeal artery. SAH, that is because of Barry aneurysm. ICH, intracerebral hemorrhage, commonly due to hypertension, that is middle cerebral artery. MCA, Charcot-Bouchard aneurysm because of hypertension. So, the answer is basically SDH. Try to memorize this. A very interesting AI image. Subdural hematoma, concave, crescent shaped. Bridging veins, commonly seen in elderly alcoholic person. It is banana shape. Okay, banana. And try to remember this SDH is also common in punch drunk syndrome. okay, and in also in boxers. Both are important. Boxers, punch drunk syndrome, and in old age. It can be acute, subacute, and chronic. So, in chronic, when it is more than 3 months, there will be formation of the membrane. Now, look at this. This is epidural hematoma, convex or lens shaped, middle meningeal artery, lucid interval. Lucid interval commonly seen in ADH, not in SDH. Lucid interval is a period of consciousness between the two periods of unconsciousness. Lucid interval testamentary capacity is positive. The person can make valid will. So, very important. I hope you are enjoying the class, Bharat. Thunderclap headache. Good, Dr. Sajad. Thunderclap headache, worst headache of the life, that is commonly seen in berry aneurysm. That is commonly involves the base of the skull, base of the brain, and from the anterior circulation of the circle of Willis. Good answer. ठीक है, good. अच्छा, भरत इज टेलिंग सर अंदर है तो दैट इज सब ओके फाइन, ठीक है, हो गया. देन next question from very important. Identify the finding during autopsy of victim of murder. So murder means, remember, 103 BNS. Murder is equal to guilty mind and guilty act. Mens rea, actus reus. So died as a result of shock and hemorrhage. So options are defense injury, antemortem, postmortem, hesitation cuts. Look at this injury. So the injury is over the palmar surface, especially over the web, between the space between the two fingers. So this seems to be active defense injury. Passive defense injury commonly seen over the back of the hand and over the forearm. So the answer is defense wounds because it is murder. Antemortem, postmortem, that is ruled out. Anyway, it is antemortem only. So even B also can be answered, but better answer is A more than B. Hesitation cuts commonly seen in suicide. So there will be a large cut surrounded by the parallel superficial cuts. Very common in borderline personality disorder. The most common method of suicide in India, that is hanging. Yes, okay. Bharat, at the end you just remind me. I'll help you in that. Okay. So this is about the question number 8. Defense injury can be active and passive. Okay. Active or passive. The active injury when victim tries to grab the weapon, the common injury over the palmar surface. Passive injury when victim tries to escape from the injury, like this, when you give hand like this. This is passive injury. This is active injury. For example, this is the knife. This is active injury. And this is passive when person tries to protect himself. So very, very interesting question, commonly asked. चलो आगे देखते हैं. वेरी इंपॉर्टेंट क्वेश्चन है, बार बार पूछते एग्जाम में. What is the active principle of the poison given below? Look at this. Black or brown color seed, which are heart shaped, have a projection at one end, which is very well organic irritant. Yes, come on, what is this? Try. Can it be resin? No, not the answer. Resin is the active principle of castor. Rolled out. Abrin is the active principle of rati seeds. Calotropis or calotropin, calatoxin, that is basically active principle of madder juice. Answer is bilavenolol. Semicarpal, bilavenolol, active principle of marking nut. What is this? Marking nut. Okay? It's an organic irritant. Now, very important question. 1, 2, 3, 4, 6 images are there. Can anyone try? What are these images? Image based question. A, B, C, D, E and F. Chalo, dekhte hai. Now who is going to answer this? Beautiful slide with a beautiful picture. Try, come on guys, try. Try. You just type in the chat box. So I'll give you around 20-25 seconds time. Just go through these images, identify. What is this? Shiny seeds are there. Very, very poisonous seeds, organic irritant. This is again the shiny seeds plant. What is this? Already we discussed. What about this? What about this and this? Okay, Ayush is telling, sir, chili seeds. Okay, F is chili seeds. Very good. It leads to human hand. MCQ. FMGE. Human hand is a type of dermatitis caused by chili seeds. Chili seeds are used in Hyderabadi goli. Very important. Second, ये देखो बताओ, ये देख के बताओ क्या है? ये है castor seed. Castor. They are shiny, looks like a tick, have brown black markings. Resinous communist seeds, the agent of bioterrorism. Very famous case is umbrella murder case. So this is umbrella murder case, bioterrorism, castor seeds. Done. This is castor plant. Castor plant. Okay, castor plant. The capsule occur in clusters. ठीक है, हो गया. This is already I said marking nut. Marking nut. Bilevanolol, semicarpal, used in criminal abortion, artificial bruise, pakka question. Then look at this now. This is red color and a black color. Very, very interesting. Interesting color. It is used as arrow poison. Also used as a cattle poison. What is this? चलो देखते हैं. Now Rakesh is telling, sir, this is, अच्छा, this nobody has answered. Smooth specialist is telling, sir, RNA polymerase. अच्छा, हाँ, this is nobody has answered. This is basically rati seeds. Rati seeds. Rati seeds consist of abrin, abralin, used as an arrow poison in cattle poison. Rati. Good answer. Good. Good, Ayush. Gunchi. Great answer. चलो आगे देखते हैं. Now one more very interesting question, that is from cannabis. There are preparations of cannabis now. As you know, cannabis is a deliriant. The active principle 9-tetrahydrocannabinol. There are 5 preparations. Can anyone try? What are these preparations? A, B, C, D, and we have, yes, E and F also. जल्दी बताओ, जल्दी बताओ. Cannabis. Cannabis is deliriant. Deliriant. Cannabis causes run amok. Run amok. It is the most common substance of abuse. My question is, what are these preparations known as? ठीक है, I answered. Good, good answer. Yadikul Reddy. Yes, चलो बताओ. Smooth specialist. That's great. हाँ, A क्या है बताओ? A is basically bang. Around 10 to 15%. Okay. 10 to 15% of active principle. It is a beverage. Beverage. B, what is B? The B is a laddu. What is that laddu? Laddu, that is sweet. Mazoon. Mazoon. Maznu nahi, mazoon. ठीक है. C, that is cannabis cookies. And D, that is ganja. The ganja around 15 to 25. And what you can see here, this is basically charas. This is around 25 to 40%. Charas. And this is hashish oil. Hashish oil around 60%. So there are many preparation. Commonly asked is, one is bhang, ganja, charas, and hashish oil. Most concentrated is, that is hashish oil. The chronic cannabis intake causes amotivational syndrome and run amok. Run amok is an impulse disorder characterized by homicidal mania. Frequently asked. Good. Chalo. So this is about the cannabis. Cannabis pakka question in exam. Chalo, ho gaya. Done. Now identify this plant. What is this plant? What is the medical legal importance? Try. Try. What is this? So you can see the pink color flower. which is used in abortion, criminal abortion, and artificial bruise. What is this? Identify this. Yes, this is calotropis. Calotropis. Calotropis is of two type. एक है प्रोसेरा, दूसरा है गिगैंटिया. याद रखना FMGE क्वेश्चन, गिगैंटिया, गिगैंटिन इज द एक्टिव प्रिंसिपल. Gigantin. The Procera means white color flower. Gigantia, pink color flower. So this is basically pink color flower. It is Gigantia. Gigantia is the correct answer. Good. बहुत बढ़िया. चलो आगे देखते हैं. Now 10th question. Identify the sign given in the image. Asked in FMGE. Repeat question. Look at the image there. So there is a hematoma behind the ear. Behind the ear. Options are battle sign, Magnum sign, raccoon sign, sixpenny bruise. Chalo, answer this. Yes, Riyaj. Ha, very good. Deepshika is telling sir battle sign. Good answer. Battle sign. It is commonly seen in middle cranial fossa fracture. Magnum sign. Very important. This is Magnum sign. Scratch marks all over the body. Magnum sign seen in cocaine poison. Cocaine. Raccoon sign, anterocranial fossa fracture. Sixpenny bruise. Sixpenny bruise commonly seen in case of throttling, manual strangulation. I'll repeat again. Battle sign, middle cranial fossa fracture. Magnum sign, cocaine poison. Raccoon sign, that is the hematoma around the eye, anterocranial fossa fracture. Sixpenny bruise, basically that is sixpenny bruise, throttling. In throttling, the most common fracture is hard bone fracture, that is inward compression fracture. Frequently asked. बहुत बढ़िया, many answered. Great. Anantraj, great. Ayush, Hinduvadi, Ibrahim, all answered. Avinay Gupta, great answer. Pakka. You are going to pass this time, don't worry. Pakka. Hard bone. Chalo, theek hai. Ha, now I have a question for you. The question is from Booth Bungalow series. Silent while speaking, speaks when dead. Now this is the autopsy image. So now you are in the crime scene. 52-year-old female, unable to talk. Quadriplegia, weakness in all the four limbs. Dyspnea, misleading history is given. Now during autopsy examination, so what we found is the scratch mark. So there are some vertical scratch marks, horizontal scratch mark. You can make out here. My question is, what is this method of strangulation? Jaldi batao. What is the best answer? So when you see scratch mark, when you see inward fracture of hard bone, the answer must be throttling. It's a case of throttling. The cause of death is asphyxia or vasovagal inhibition or venous congestion. Basically, asphyxia is the cause of death. Good. Chalo, theek hai. So next question, very important question, guys. FMGE question, repeat question. So go through this question. A boy was playing in a garden. Suddenly he collapsed, was rushed to the hospital. His friend who played with him in the garden informed that he ate one of the fruit. So this is the one of the fruit. And he came with a history of restlessness, dry hot skin, unable to pass urine, dysuria. And what is the poison? What is the antidote? What is the poison and what is the antidote? Now look at this. This is thorn apple. You can see multiple spiny projections. This is the plant of the datura, which consists of hyoscine, hyoscyamine and traces of atropine. So the answer is datura poison. and physostigmine. Physostigmine, correct answer. Physostigmine, good, smooth specialist, correct answer. So Datura, just try to memorize. It's a deliriant. It causes delirium, point number 1. Point number 2, 9D manifestation. 9D clinical features. It causes muttering delirium, carpologia, confusion. Treatment, physostigmine. It is a well-known road poison used in robbery, sometime in kidnapping, sometime in sexual assault. Railway poison. Okay? So all these are frequently asked. And this is basically lipid soluble. The hemodialysis of no use, especially in case of Datura poison. There are 4 deliriants. Try to memorize. Deliriants are, one is Datura, thorn apple, second one cannabis, Indian hemp, third one cocaine, and one more is atropine, Atropa belladonna. All 4 are deliriants. Remember, cocaine, very commonly asked, cocaine increases norepinephrine level. It causes hypertension, it causes hyperthermia, it causes sweating, sometimes myocardial infarction, stroke and death. The classical feature of cocaine withdrawal syndrome, that is tactile hallucination and scratch mark. So hot skin is the way, that is good. Good answer, Aish. So this is about the question number 11. Now, question number 12, very important. Look at this, a plant. The plant has yellow flower, which is known as pricky poppy. Pricky poppy. Can anyone tell me what is this plant? It's a poisonous plant which increases venous permeability, edema. It causes glaucoma and death. What is this? A cocaine treatment is amyl nitrate. You are right. Rayaj, ये क्या है बताओ? So this is basically Argemona mexicana plant. Argemona mexicana, which causes epidemic dropsy. So what is the active principle? The active principle is sanguinarine. Sanguinarine. So what are the clinical features? Edema, glaucoma and others. It is because of the mixing Argemona mexicana seeds with the mustard seeds. So the answer is A. Nerium odorum is a cardiac poison. Active principle nerin, neriodarine. Papaver somniferum is basically opium plant. Calotropis already we discussed, which is a well-known agent used in criminal abortion and artificial bruise. Try to memorize. This is a very important topic, especially FMGE students. Neuroletheriasis, epidemic dropsy, endemic ascites. Neuroletheriasis is a crippling disease caused by beta-oxalyl aminoalanine, basically consumption of kesari dal. Epidemic dropsy, sanguinarine, pricky poppy. Endemic ascites because of pyrrozolidine, that is because of crotalaria seeds, which is a hepatotoxin. So 3 important questions frequently asked in the exam. Okay, come on guys. Rakesh, smooth specialist. Avinay Gupta, it is asked more than 50 times in recent exam. 50 times. Crippling disease, that is neuroletheriasis. 1 stick, 2 stick, crawling stage. Okay, it causes neuroletheriasis. There is osteoletheriasis and other conditions also. This is commonly asked. Epidemic dropsy can lead to cardiac failure and death. Endemic ascites basically causes jaundice because of the pyrazolidine. Yes, guys, are you okay? Yeah. Now, what is this condition? Identify this condition. Try. Steeping, parboiling, vitamin C, good answer, good. What is this? This is basically single stick stage of neuroletheriasis. Kesari dal, beta oxalyl amino alanine. Okay, chalo. Next is the snakes, big four snakes, commonly asked. A patient presented with a history of snake bite along with ptosis. The patient is having drooping eyelid because of involvement of the levator palpebrae superiorus. Paralysis, external ophthalmoplegia, weakness of the extraocular muscles. Unable to speak, raise the head from the supine position. That is known as broken neck sign. So, all this suggestive of neurotoxicity. Neurotoxicity. So, what are neurotoxic snake? They are basically elapidae. What are elapidae? The elapidae, cobra. So, it can be common cobra, king cobra, common crate, mamba, and coral. Neurotoxic. What are hemotoxic? Hemotoxic, basically vipers, star-scaled viper, Russell's viper, pit viper, hump-nosed viper. So, remember hemotoxic, they cause bleeding tendencies, increased clotting time, increased bleeding time, DIC and death. Local symptoms are maximum in hemotoxic bites. And some are myotoxic. Myotoxic, sea snakes. They cause weakness of the shoulder, weakness of the neck muscles and death. So, myotoxic, neurotoxic, hemotoxic and myotoxic. So, what is the best answer here? Come on. Okay. So, the answer is common cobra, correct answer. Remember common cobra, it is postsynaptic. Postsynaptic. Common crate, presynaptic. Neostigmine is given in cobra, not in common crate. The common crate is very dangerous snake. The fatal dosage 3 to 6 milligram. FMGE question. So, all these are FMGE questions asked in the exam. FMGE. Okay? Then what is the approach in poison snake bite? Right approach. Right. Again, question can be asked, what is right? R for reassurance, I for immobilization, GH get to the hospital, T for tell the doctor about the emergence of symptoms. The treatment of choice, ASV. Drug of choice, ASV. Again, what is the common side effect of ASV? Anaphylaxis. The same dose is given in children as well. Okay? So, yes. Fine. Now look at this. This is the very important image, frequently asked. Russell's viper, Dubai Russelli, which has triangular head, constricted neck, broad body, pointed tail. Common crate, Bungarus ceruleus, which has wide transverse bands, thin band. It's very fatal. Fatal dosage 3 to 6 milligram. This is hood. When you see hood, spectacle mark, that is basically common cobra, Indian cobra. Naja. Then star-scaled viper, Achis carinatus, which has triangular head again, which has diamond shaped area, white wavy line. So, the first two, this is basically neurotoxic. This is basically hemotoxic. So this is okay, commonly asked. Okay, chalo. Fine. The next question, important question. During autopsy, a case of electrocution. See, electrocution, lightning, very commonly asked in the exam. Low voltage burn. So low voltage means less than 1000. Showing following finding. What is the classical finding? Filigree burn, jewel burn, crocodile skin burn, arborescent markings. Look at this. What you can see here, there is a finding here. What is the finding here? Which has central necrosis surrounded by brown color area, crater formation we call it as, which shows the entry wound of the electric current, entry mark. What is this basically? So this is basically entry wound. The answer is jewel burn. So jewel burn is a feature of endogenous electric injury, usually low voltage. Filigree burn, arborescent marking, pakka question. Filigree burn is commonly seen in lightning. The cause of death in filigree burn is ventricular fibrillation or respiratory paralysis. Crocodile skin burn, flash burn, usually high voltage burn. Arborescent marking, that is again lightning. This is favorite of FMGE question. Okay? Fine. Now one more image is there. Can identify these two images? What is this A? What is this B? So in A, you can see multiple black color skin nodules are there. In B, tree-like pattern. Tree-like pattern. What is this? Try. All of you try this question. Frequently asked. So A is high voltage burn. That is basically crocodile skin burn. The B is basically filigree burn. So both are image based question. Okay? Now repeat question from FMG. Identification. Tattoo mark. Again, tattoo mark was asked in the recent INA CET also. Okay? Good. A deceased male was brought to mortuary for post-mortem examination. His relatives reported that he had a tattoo over the skin which was not found on examination. So history is telling some tattoo, but tattoo is not there. Tattoo is not visible. Which of the following structure would you examine? It's a tattoo. Tattoo means that is the indigo and other stains. It's a foreign body. It enters into the nearby lymph nodes. So the answer is lymph nodes. Basically, the tattoo appears in the superficial dermis. Basically below the epidermis. Superficial dermis. So tattoo can help you to identify the religion. It can identify the personality, maybe sexual paraphilia and all. Like bluebird sign is a feature of homosexuality. So answer is very simple, lymph node. Now sexual offences, one of the very important FMGE question. All of you concentrate. So what is this? So the male showing genitals. A guy was sitting on the balcony which was overlooking a park. He always used to sit nude on his balcony and derived sexual gratification. It's abnormal sexual behavior, persistent abnormal sexual behavior since 6 months without any intercourse. observing the people. Okay, what is the best answer? Can you try this? So this is classical exhibitionism. Remember, exhibitionism is of 4 types. What are the 4 types? Can anyone answer? What are 4 types? Anarisma, that is common in females. Type 1. Mooning, streaking, running naked, flashing. Okay. So it is punishable under 296 BNS. So this can be asked in your exam. Exhibitionism is punishable under 296 Bharatiya Nyaya Samhita. So all of you type in the chat box, exhibitionism is equal to 296. Just type one word. You can interact with me so that we can make the class very interesting, somewhat that can increase your attention, my attention. You can make yourself attentive. You can make me attentive also. है ना? So चलो बताओ. Voyeurism is Lady Godevia, peeping Tom. Okay. So camera and all, right? That is peeping Tom. And it is punishable under 77 BNS. Voyeurism, video voyeurism. So taking the nude photo, video of the female while using private, private acts, maybe while using public lavatory. So that is voyeurism. Fetichism, basically inanimate object. Inanimate object or abnormal sexual focus. That is fetichism. One common fetish is shoe fetish or foot fetish. Most common fetish is foot fetish. Foot. Masochism is opposite to sadism. That is basically giving pain to the partner to get sexual pleasure. So that is sadism. Masochism is taking pain. Sometimes sadism, masochism occur together. That is known as bondage. Okay? So yeah, masochism can lead to autoerotic asphyxia. One of the smooth specialists. You are right. You are great. Yes, fine. Just a minute. Chat box on करो यार. Okay. Yes, you are right. चलो आगे देखते हैं. Next question. ठीक है. Codes varism. That's fine. That's great. Okay. That's okay. चलो next question. Next question. Again from toxicology. Toxicology, very important. A patient came with the complaints of hair loss. Alopecia is there. His wife mentions that so there are some behavioral changes. Doctor notices there is a loss of eyebrow, madarosis is there. He then comes to conclusion by examining the nails. Look at the nails here. So what is the finding this? What is this finding? Can anyone try? What is this finding? And what is the answer? Options are thallium, arsenic, mercury, lead. Very important question. So this is Aldrich-Mees line. Aldrich-Mees line. Aldrich-Mees line can be seen in arsenic and thallium. The arsenic is an ideal homicidal. It is known as king of all poison. Thallium is also ideal homicidal. It is known as king of all kings. So what is the best answer? Patient is having hair loss, madarosis, behavioral changes, no diarrhea, no rice water diarrhea. What would be the best answer? The best answer is not arsenic, guys. The answer is not arsenic. The arsenic resemble like cholera, rice water stool. Mercury characterized by mercuria lentis and tremors, Pink's disease, Minimata disease. Not the answer. Lead poison commonly presents with the pain, abdominal pain and constipation, known as Saturnism. Not the answer. So finally, the answer is thallium. So in thallium, so there will be hair loss, alopecia, neuropathy, and Aldrich Mees line. It is known as king of all kings, also known as poisoner's poison. Poisonous poison. The treatment is Prussian blue. Good answer. I think the first to answer by smooth specialist, then by Ayush Shukla, Ibrahim, okay. Divya said thallium, that's great. Royal Khan, great. Sure, बहुत बढ़िया. आगे देखते हैं. Type of hymen given in the image. FMGE question. Okay. Type of hymen. You can see the two openings here. When you see two openings, septate hymen. Semilunar, annular, basically they are common types of hymen. Fimbriated, that shows notches. Okay, you can see here this image. So this is the question asked in the exam. The central opening, that is annular hymen. Crescentic hymen, crescent shape. Two opening septate hymen. Multiple opening cribriform hymen. Fimbriated hymen that shows notches. It resembles like torn hymen. Now MCQ here, say example, this is the hymen. The hymen. This is 12 o'clock position, 6 o'clock position. What is the common site of hymen tear? What is the common site of hymen tear in penetration of the penis? Penetration. The point number 1. The most common site is posterolateral. Posterolateral. Somewhere here. In case of insertion, digital insertion, we call it as insertion. In insertion, it is anterior. Somewhere here. Okay. And remember, in children, hymen tear is very uncommon because it is deep seated. Deep seated, MCQ. The instrument used, that is GK rod, Gleister Keene rod, along with lateral buttock test in case of sodomy. Then, one more point, we use toluidine blue. Toluidine blue. Can anyone tell me what is the use of toluidine blue? What is the use of toluidine blue? Batao, asked in the exam. Come on, try. Toluidine blue stains DNA and RNA, basically for recent injuries, recent micro injuries. Asked in the exam. Micro recent injuries. So commonly asked in the exam. Lugol's iodine, that is used in examination of accused of rape. That is to identify vaginal cells over the sexual organ. That is Lugol's iodine. This is toluidine blue. Sometimes you can use Wood's lamp also. Wood's lamp, basically for seminal stain. And try to memorize one very important question, FMGE question, that is victim examination. What is the BNSS? Accused. What is the BNS section? Can anyone try? Can anyone in the chat box? Medical examination of victim of rape comes under dash BNSS. Medical examination of accused of rape comes under dash BNSS. If you answer, you'll get chocolate from me. 3D chocolate from me. Yes, try guys, try. Come on, try. Smooth specialists. Victim 51. No, it's not 51. Okay. Accused telling 286. No. Yes, याद नहीं है सर. याद रखना पड़ेगा बेटा. वेरी इंपॉर्टेंट क्वेश्चन है. बार बार आते हैं एग्जाम में. पक्का क्वेश्चन है. ठीक है. सो याद रखना पड़ेगा. विक्टिम एग्जामिनेशन है ना, 184 में आता है. अक्यूज आता है 52 में. ठीक है. पुलिस इंक्वेस्ट 194, मैजिस्ट्रेट इंक्वेस्ट 196. पुलिस 194, मैजिस्ट्रेट 196, all BNSS. Dying declaration, FMG question 26A. Dying declaration 26A of BSc. ठीक है. Many questions can be asked. ठीक है, बहुत बढ़िया. चलो आगे देखते हैं. नेक्स्ट क्वेश्चन. I'll repeat again. याद रखना 184, 52, 194 and 196. 4 important BNSS. Yes, Riyaj, that's okay. Next is very important question. So this is about the cyanide Mallika story, cyanide Mohan Kumar story. When I talk about cyanide poison, I remember very famous crime story, repeat offender of the rape, that is cyanide story. A factory worker brought unconscious. He has cherry red skin. So very interesting question. Cherry red, bitter almond, severe metabolic acidosis. Cherry red carbon monoxide, but somewhat pink, bright red, that is seen in cyanide also. Remember, cherry red carbon monoxide, bitter almond cyanide. Okay. Metabolic acidosis seen in both the conditions. So what would be the best answer? The answer is simple. It is not acetylcholine esterase. So acetylcholine esterase is basically in case of OP poison. Carbonic anhydrase, no. Na plus K plus ATPase, no. The best answer is cytochrome oxidase complex 4. Complex 4 inhibited by carbon monoxide, cyanide, hydrogen sulfide and others. Hydrogen sulfide also. And remember, the treatment of cyanide commonly asked. So what is the treatment of cyanide poisoning? Can anyone answer? What are 3 drugs used in cyanide? 3 drugs in cyanide poison. Come on, try. Come on. I'll give you some 10-second time. Meanwhile, so let's sing a song for you. Shall I sing a song for you? If you want, I can sing a Kannada song. ठीक है. Ibrahim, can you try? You can just try and you keep writing. What are 3 drugs, Trimurtis in cyanide poison? Come on, guys, come on. Try. So the answer is, yes, very good, Danish Gowda, very good. Lily kit, good, Lily kit, that's okay. So what does that consist of? That consists of amyl nitrate, sodium nitrate, sodium thiosulfate, very good. Intravenously sodium nitrate and sodium thiosulfate. Amyl nitrate is given inhalationally. Lily kit, good answer. So I think smooth specialist have answered very well. So let me sing a song for you. Okay. ಹಾಡೊಂದು ನಾ ಹಾಡುವೆನು ಹೃದಯ ರಾಗದಲ್ಲಿ ಕವಿತೆಯನ್ನು ಬರೆಯುವೆನು ಮನದ ಆಳದಲ್ಲಿ ಹಾಡೊಂದು ನಾ ಹಾಡುವೆನು. Yes, okay, smooth specialist, good answer. Good. Chalo dekhte hain. Next question. And remember, sodium nitrate, it produces methemoglobin. So methemoglobin combines with the cyanide, it forms cyanomethemoglobin. Cyanomethemoglobin combines with the sodium thiosulfate, it gets excreted in the urine. That is a funda. Okay? Good, smooth specialist, thank you. Chalo आगे देखते हैं. Chalo. Next question is very interesting question, guys. Two friends consumed alcohol. So alcohol is a CNS depressant. So alcohol can be of different types: beer, whiskey, vodka, sherry, and all. Legal limit of alcohol is 30 milligram percentage. So alcohol causes 3 stages: stage of excitement, stage of incoordination, stage of coma. Massive sign is commonly seen in case of alcoholic coma. So alcohol, after which they fought for common girlfriend. So it's a girlfriend matter. मामला बहुत serious है. One of them pushes other on the floor, covers his face, then and also sitting on him. Okay, so now look at this. What is this method basically? Now look at this brownie, the closure of the mouth and nostril, and that is compression of the chest, traumatic asphyxia, and homicidal smothering. What is this method known as? Very interesting. Come on, guys. ठीक है? Brownie, what is the answer? Can answer. Say hi to a brownie. Our interesting character, my friend in my class, brownie. So brownie, traumatic asphyxia, and homicidal smothering. The answer is very simple. The simple is Burking method. So what is Burking? So Burking is a method of suffocation. It's combination of traumatic asphyxia and smothering, homicidal smothering. Okay. The smothering means closure of external air passages. Bansdola. The Bansdola, basically by using iron rod or bamboo stick. So this is basically bamboo stick. Mugging, that is constriction of neck in the elbow bend. So elbow bend or knee bend. So the cause of death in most of the cases, it is basically asphyxia. Asphyxia is the cause of death. Okay? So this is very commonly asked in the exam. See, this is how the Bansdola is done. Okay. So, Bansdola like this. So, try to memorize this, guys. Okay. This is basically a bamboo stick. The bamboo sticks are placed like this between the neck. So, neck is placed in between and constriction of neck. So, this is Bansdola. Are you getting my point, guys? Bansdola. Very interesting. Forensic is very interesting. So, it causes railway bruise. Remember, bamboo stick causes a railway bruise. It's a blunt weapon. It causes abrasion, bruise and laceration. It can lead to death by causing asphyxia, that is classically known as Bansdola. Okay? So, that is very, very interesting. चलो बहुत बढ़िया आगे देखते हैं नेक्स्ट क्वेश्चन द क्वेश्चन नंबर 21 very interesting question. A 3-year-old child sleeping in a hut woke up in the middle of the night screaming. The patient is crying because of the pain. Her mother thought child had a nightmare, tried to pacify her. After some time, she noticed that the child was having sweating. The sweating because of release of catecholamines profusely, and the hands were becoming cold. So, what is the best answer? She vomited a couple of times. BP is low. Tachycardia is there. What is the best answer? Snake bite, scorpion bite, septic shock, food poisoning. Food poisoning, not the answer. The food poison presents with nausea, vomiting, abdominal pain and all, not the sweating. Septic shock presents with the fever, not the answer. It can be snake bite, but history of snake bite is not given. There is no ptosis. So, better answer is scorpion bite. In scorpion bite, because of catecholamines, especially norepinephrine and epinephrine, it causes sweating. Point number 1, because scorpion sting stimulate adrenal gland and there will be extreme pain. The drug of choice, a treatment of choice is anti-scorpion venom, asked in FMGE exam, and one more drug, that is prazosin. You can give atropine also to decrease pulmonary edema. You can give lignocaine for the pain. So, bite marks, yes, you are right. Some student asked me, sir, bite mark. The bite mark resembles like snake bite. Okay. Or who knows, there are two bites on the same site. But the clinical feature go in favor of scorpion sting. Okay. So, yes, priapism, very good. Priapism is seen in case of scorpion. Okay. Then the one more question asked is torture method. Torture, frequently asked. A person under police custody is made to lie on the prone position, like this, prone position, and his ankle, wrist were tied. Ankle and wrist are tied. What is the name of this torture? La bandera, falanga, hawk tying, Bansdola. 2 bites, yeah. Okay. What is this method? So, this method is known as hawk tying. La bandera, basically suspension, high suspension at the level of wrist. Falanga, that is beating on the palm and sole. Bansdola, already I said, that is bamboo. The better answer is Hawktake. Try to memorize Tokyo Declaration. Tokyo Declaration by World Medical Association related to torture. Okay. Any other declaration? Yes. Any other declaration other than Tokyo? Come on. Smooth specialist. I said Tokyo. Any other declaration related to torture? Tokyo torture. Any other? हम torture नहीं करेंगे. हम torture नहीं करेंगे. हम. I'm giving you. हम torture नहीं करेंगे बेटा. नहीं करेंगे. हाँ हाँ बहुत बढ़िया. बताओ. माल्टा हंगर है. माल्टा हंगर बताया. टर्की टर्की नहीं. टोक्यो बताया. Hamburg. Declaration of Hamburg. So this can be asked. Hamburg. Oslo. That is abortion. Remember therapeutic abortion. Helsinki. Human experimentation. Hippocratic medical ethics. So there are many declarations commonly asked in the exam. Okay? Hamburg. Now very interesting question. Torture methods. There are 5 torture methods. You need to identify now. Come on, try. Try. 5 methods. Try. What is this method? Suspension with the help of a pole in supine position. Hanged. What is this? So this is parrot perch. So which causes severe pain, positional asphyxia and death. And this is already I said phalanga. This is high suspension. Looks like a Palestinian hanging. See, Palestinian hanging, low suspension. The same type, low suspension. Here it is high suspension. Entire body is suspended. So this is La Bandera. La Bandera. If it is suspended at the level of ankle, D Murcielago. याद रखना पड़ेगा. D Murcielago at the level of ankles. At the level of wrist, it is La Bandera. This is dry submarine. Like a plastic cover around the face, which causes severe suffocation and death. This is wet submarine. The victim is made to drink feces or some water or immersion of head into the water. Wet submarine. All these are torture methods. Either they cause asphyxia or suffocation, positional asphyxia and death. So torture methods are not allowed by the doctors as per Tokyo Declaration, Declaration of Hamburg. Okay? So other methods also. So that is given in your notes. You can just go through that. Okay. Okay. The cause of injury in this person: electrocution, lightning, scald and blunt force trauma. Look at this. This is tree-like pattern. When you see tree-like pattern, it must be a case of lightning. Lightning. What is the cause of death in lightning? Ventricular fibrillation. Ventricular fibrillation. This is known as filigree burn. Filigree burn, arborescent burn, Lichtenberg flower burn. Lichtenberg flower. The mnemonic is fall. Okay. Filigree, arborescent, Lichtenberg, lightning, that is lightning balls. This is commonly asked. Now, electrocution. In electrocution, the finding is jewel burn, also known as endogenous burn. Entry wound, the classical of electrocution. Cause of death, ventricular fibrillation. And remember electrocution, rule of 9. Rule of 9. FMGE question. Can anyone tell me? As per rule of 9, one upper limb is equal to how much is the burn injury? One lower limb is equal to how much is the burn injury? Can you try? Can you try, guys? Try. Can you try? So, one upper limb is equal to 9%, one lower limb is equal to 18%. The head and neck area 9%. Okay. Trunk. So, trunk front and back 18. Thorax front and back 18. Pudendal area 1%. So, one more rule is Browder rule. LB formula, that is in case of children's. One more very commonly asked question, FMG question, guys. Try to memorize. Palmer rule. That is 1% rule. One hand is equal to 1%. What is the cause of death in case of burn injury? Most common cause of death is septicemia after 3 days. Before 3 days, it can be neurogenic shock or it can be hypovolemic shock. Okay. Then high voltage burn, the crocodile skin burn. The exit wound is very uncommon. Okay. Then lightning, I said already. Scald injury, just remember, caused by moist heat. Can anyone tell me what is the feature of scald? What are the features, the post-mortem finding in scald injury? Try. Danish Gowda, Divya, Rehana. In scald, remember, it is well demarcated. You will see well demarcation between affected area and unaffected area. Second thing, bleached appearance. Soddening. So, whenever word soddening, that is moist heat. This can be asked. Blunt force trauma leads to 3 injuries. One is abrasion. Second one is bruise. The third one is laceration. Abrasion can be of 4 types we discussed today. Bruise can be of different types. Superficial bruise, deep bruise, okay, and all. Laceration, again 4 types we discussed today. Sharp force trauma, either it lead to incised wound, stab wound, chop wound. So, this can be asked in your exam. Fine, guys. I hope you are getting my point. Soddening, demarcation, and charring is absent in moist heat, scald. This is about 23, topic number 23. आगे देखते हैं. हाँ, now this is very important question. Very nice question. Commonly asked in the exam. 76-year-old woman who had been living alone was found dead due to MI. MI is the most common cause of sudden death. Most commonly involves LAD. LAD, left anti-descending artery, known as widow artery. In her home, in a sitting position, holding a glass like this. This is antemortem phenomena. What is that finding known as? Yes, can anyone tell me what is the finding here? Look at this image. So, the glass in the hand, there is a contraction of the voluntary muscles of the hand. There is a postmortem hypostasis in the front of the postmortem hypostasis is there. So, what is this basically? It looks antemortem finding, cataleptic rigidity. So, it is cadaveric spasm, or we can call it as cataleptic rigidity. So, it is an antemortem contraction. It is not postmortem, also known as cadaveric spasm. So, very commonly asked FMGE question. And remember, it always involves voluntary muscle. The pH is alkaline. It shows manner of death, sometimes cause of death. Okay. So, frequently asked. The answer is cataleptic rigidity. B is the answer. Rigor mortis. One more very important question. Rigor mortis is postmortem. Point number 1. The point number 2, it involves voluntary, involuntary muscle, all the muscles. It involves voluntary, involuntary, all the muscles. The first muscle is heart. The first voluntary muscle is eyelid. Last muscle, the muscles of the hand. Okay? Yes. The first muscle is heart. The second muscle is eyelid. Lastly, small muscles of the hand. Can anyone tell me what is the rule known as? What is the rule of rigor mortis? Yes. What is the rule of rigor mortis? The exact pathology is not known. Cadaveric spasm. Okay? Not known. Can anyone tell me what are the rules of rigor mortis? 3 rules are there. 3 rules. Batao? Smooth specialist telling, sir, Nishtan rule. Yes, Nishtan rule. Shapiro rule. Rule of 12. Rule of 12. Very important. Rigor mortis is a sign of death. Okay? 3 rules are there. Proximo-distal progression, Shapiro rule. The first eyelid, then face, neck, chest, upper limb, lower limb, that is Nishtan rule. Rule of 12, it appears in 12 hours, maintained for 12 hours, disappears in 12 hours, rule of 12. Now comes his Algor mortis. What is Algor mortis? Algor mortis is postmortem cooling. Again, this is very commonly asked. What is the preferred site of recording body temperature in dead body? What is the preferred site of recording body temperature in dead? Try. So, Algor mortis, it's very important in estimation of time since death. The preferred site is rectum or under surface of liver. or middle ear by using tenometer. Very important. Rectum, sigmoid curve, very good. It has sigmoid curve, plateau phase, ascending plateau and declining phase. Good answer. Heat stiffening, basically known as boxer attitude. Boxer attitude. It can be antemortem or it can be postmortem. So when I talk about heat stiffening, I remember Tandoor murder case. Very famous case of heat stiffening. Again, all these are commonly asked. Now, one student asked me difference between rigor mortis, cadaveric spasm. So let's discuss. Rigor mortis, time of onset 1 to 2 hours. Cadaveric spasm, immediate. Mechanism here, depletion of ATP. Here, not known. All muscles. Here, voluntary muscle. Moderate. Here, strong contraction. Predisposing factor, none here. Here, sudden death. Excitement. Fear. Emotional disturbance, etc. Molecular death occurs here, but here does not occur. Electrical stimuli, muscles do not respond. Here, muscle can respond. So, all these are differences frequently asked in your exam. Okay. So, are you okay, smooth specialist? I hope you got the answer. Basic differences. Remember, molecular death occurs in rigor mortis. Molecular death, cellular death is not the feature of cadaveric spasm. The cadaveric spasm can respond to electrical mechanical stimuli, that is known as Zarco phenomena. Zarco phenomena, frequently asked. Okay, chalo. And the question, last question of the day. During autopsy, doctor notices finding as shown in the image. Which is true regarding this finding? The finding here is greenish discoloration over right iliac fossa. What is this? So, this is basically putrefaction. The putrefaction is a delayed change after death, characterized by gas formation, greenish discoloration, necrosis and all. What is this finding? What is the reason for this? The greenish discoloration is because of sulf-methemoglobin caused by Clostridium welchi. Now, it is associated with lightning. Wrong. It is not associated with lightning. Ruled out. It's a vascular disease. It is not a vascular disease. It's a post-mortem change. Seen at 48 hours. Let's see. It is not 48 hours. The greenish discoloration appears in 12 to 24 hours. Okay. The first site is greenish discoloration over the right iliac fossa or the intima of the blood vessel because of the Clostridium welchi. The marbling is seen at 48 hours. So, try to understand, the marbling is around 24 to 48 hours. B is not the answer. It is due to sulf-hemoglobin. Yes, that is true, because of Clostridium welchi. So, try to remember Casper's dictum, very important question. Casper's dictum. Can anyone tell me what is Casper's dictum? Casper's dictum. Can anyone try Casper's dictum? Try, guys, try. Casper's dictum is the rate of decomposition in different media, like in air, water and earth. That is air, water and earth. As you know, in air it is very fast. Say it will take 1 day. So 1, water it will take 2 days. In buried body it takes 8 days. So this is AWE 128. All of you write awesome 128. Awesome 128 in the chat box. Awesome. You are awesome. So that is 128. Casper's dictum. I hope you are understanding. Awesome 128. So all these are important topics. Please write. Rayan, Danush, Smooth Specialist, Divya, are you there? Keep writing this. Commonly asked in the exam. Fine. So this completes most important 25 topics that can be asked in your FMGE upcoming exam. If you have any doubt, you can ask me for next 5-10 minutes. Are you there? Yes, I hope you enjoyed the class. BNS beta, I'll share you the video. There is a 30 minutes video of mine. I'll just share that in the group. You can just go through that. Tricks also I mentioned in that. You don't worry. Okay. Gunshot injury. Very good. Gunshot injury is a good question by one of the student. Chalo dekhte hai gunshot injury. So let me take a new slide. Yes. This is the slide. Some student asked me, sir, gunshot. So gunshot injury are 4 types. Basically rifled gunshot. Rifled. Okay. Rifled gunshot. There are contact shot, close shot, near shot and distant shot. Okay. So let me discuss with the pinky. So what is okay. Now look at this pinky. Say hi to our pinky. Let's discuss with the pinky now. Now this is gun. So this is contact shot. So what is this? Contact shot. So all of you remember contact shot characterized by cruciate entry wound or stellate entry wound. Point number 1. The point number 2, because of the gun, you will see muzzle imprint. Muzzle imprint. 2 important features. Now say example, this is gun and pinky here up to 9 centimeter. Up to 9 centimeter, it is close shot. 9 centimeter. Characterized by blackening and burning. The blackening is because of soot particles. Soot particles. Near shot, again, see, more than 9 centimeter, less than 60 centimeter. So more than 9, less than 60 centimeter. Near shot. The feature of near shot is tattooing. Tattooing is because of unburnt gunpowder. Unburnt gunpowder. Okay. Distant shot. This is distant shot. See now, pinky is here. This is distant shot. Distant. That is more than 60 centimeter. In distant shot, no blackening, no burning, and no tattooing. So there will be just an entry wound. just an entry wound, that is distant shot. I hope you are getting my point. Ibrahim, got it? I hope you got. So close shot, sorry, contact shot, close shot, near shot, distant shot. Done. What is the cause of death? The cause of death is shock and hemorrhage. Shock and hemorrhage. Now, here is one more funda. Yaad rakhna, this is rifle wound. In case of shotgun, it is different. Shotgun, it is different. At a distance of 1 meter, you will see rat hole entry wound. Rat hole entry wound. 1 meter distance. Between 2 to 4 meters. 2 to 4 meters, you will see satellite wound. Satellite wound. For example, this is satellite wound. Satellite wound at a distance of 2 to 4 meter. So, in general, so up to contact shot, 1 meter we call it as close shot, and 2 to 4 meter basically intermediate shot. So this is intermediate shot. Some books gives near shot also. More than 4 meters, distant shot. Okay. In distant shot, you will see multiple entry wounds like this. No satellite wound. That is about the shotgun. The range of shotgun 30 to 40 meter. Okay. In shotgun only entry wound, no exit wound. MCQ. Billiard ball effect can be asked in your exam. Okay. Billiard ball effect. Rifling. What do you mean by rifling? The presence of lands and grooves. Lands and grooves. Can anyone tell me what is caliber? Asked in FMGE. FMGE question. What is caliber? What is caliber? For example, this is the barrel. So barrel, and all these are lands and grooves. So these are lands, these are grooves. What do you mean by caliber? Can anyone try? Caliber. Yes, Ibrahim, Rakesh. बेटा राकेश, caliber क्या होता है बताओ? So the caliber is distance between two opposite lands. Distance between lands. The same question, shotgun. It is number of lead balls prepared from 1 pound of lead of equal size. 1 pound of equal size. Not grooves. Ready. It is land, not the grooves. In shotgun, number of lead balls prepared from 1 pound of lead of equal size that fit into the barrel. Okay? So all is our question asked. One more. What are the features of entry wound? What are the features of entry wound? One more question. Entry wound. Entry gunshot. Can anyone tell me? Entry wound. Try Dhanush Gowda and others. What are the features of entry? Again with the pinky now. Pinky. Now pinky is here. Entry wound, exit wound. So this is entry. What are the features of entry? Try. What are the features of entry wound? Yes, Reddy, Dhanush Gowda. Please answer. Answer, guys. Try. लाश एक मूक गवाह है जो कभी झूठ नहीं बोलती. Dead body is a silent witness that never lies. The post-mortem, Shava Pariksha, is a very important topic in your forensic medicine. Very good. I think many answered. Yes, smallest diameter. Yeah, it's small. Very good. It is small. It has inverted margin, inner table beveling, 3 points. It has tattooing, blackening, cruciate wound, that is entry wound. Okay. When burning is there, entry wound. Okay. Abrasion collar, grease collar. So all these are features of entry wound. Okay. So this is asked in your exam. So that's it about the today's lecture. If you have any doubt, you can message me in chat box in Telegram. Okay. So wish you all the best for upcoming exam, FMG exam. I hope many questions do come from this session, 2-hour session. So when you are free, if you have doubt, you can message me in WhatsApp group of FMG mentorship program of PW or in Telegram group as well. We are there to help you. Once again, wish you all the best. Thank you.